Hello, everyone, and a very good evening. You are joined with Anu on Radio 97.1 FM on a one and only dedicated interview show called The Voice of Nottingham. With me today, I have a very special guest. She is none other than Dr. Farzana Hussain. Dr. Farzana Hussain has 20 years of experience as a practicing GP principal. But she's adorned with many more accolades. She has put in a great amount of work into making healthcare in UK better and different, looked into the needs of the communities and responded towards it likewise. But I would request my guest to speak for herself. Hello, Dr. Farzana.
Hello, Anu. Thank you so much for having me.
Uh, I have given a very brief introduction of yourselves to our listeners, our audience. Would you be kind enough to tell us more about yourself and the kind of work that you're doing at the minute?
Yes, well, thank you so much, and thank you for that kind introduction. So, I've been a GP principal in Newham in East London for 22 years now, and much like our areas of Nottingham, we have a very large BAME population. In fact, 74% of Newham is BAME, and I have felt that it's actually my lifetime's work to be helping our communities. So, many of the work I've done is, for example, during the pandemic, during COVID, I was very interested in trying to help our BAME communities get more coverage for their vaccine, because we knew that it was BAME communities that were dying more of COVID, yet they weren't getting the vaccines. So I did a lot of work around that and was very fortunate to be invited to number 10 and get a shout out from the then Health Minister Matt Hancock for my work. I was also awarded GP of the Year in 2019 for my work working in an inner city with a deprived population. So I've been very fortunate during my career. I've also held some national roles with the NHS Confederation, co-chairing their National Primary Care Networks, which is a collection of GP practices. And I was also a board director for the National Association of Primary Care. So it's been lovely to have the opportunity to look after my community in East London, but also be able to have more of an impact nationally. And I have done many broadcast interviews for lots of radio stations and BBC as well. So thank you for having me here.
Thank you so very much for this wonderful introduction. And we understand that you have been doing a lot of work into the community, especially into the BME community. Today, this interview session is purely dedicated to NHS App Campaign. Now, to start with, what is this NHS App Campaign?
Yeah, that's such a great question. So what is the NHS app? The NHS app is an app. It's very simple and a secure way where people like you and me, Anu, can actually access a range of NHS services, but also find out about our own health records, which is about us. And we can download the app on any smartphone or tablet. The reason we're doing this NHS campaign now is because the app's actually been around for about 5 years, but we've noticed in the last 12 months that many more people have registered with the app. And in fact, 3/4 of adults in England are now signed up to the NHS app. But we want to make sure that everybody finds it easy and that everybody knows about it and that we're not leaving any community behind, so that they can get the benefits from having the NHS app on their smartphone or their tablet.
All right. Okay, that sounds good. Yes, because even I have an NHS app on my mobile, and that's made life so much more easier to book appointments or to look into our records. So, what is the objective of this campaign, if you may elaborate on that? You just said that you have seen in the last 12 months there has been an influx of people downloading the app or using the app. So then what is the objective of this campaign at this point of time?
So we're aware, Anu, that still a quarter of people haven't downloaded the app. And we're also aware that of the 3/4 of adults, that's 34 million people, they've downloaded it. But maybe not everybody is using it to the best of its capacity because, it's a new thing and we just may not be sure. So the idea behind this campaign is to just make it easy and to help people understand how to use it. So a very personal example, not only as a doctor, now I'm 51, I recently got started on some long-term medication and I haven't been on any medications before. And I'm busy, like many of our ladies and gentlemen are working. It was fabulous. I didn't even need to go into my GP surgery that's a 15-minute walk away. I was able to just request my medications on the app, nominate the pharmacy I wanted, which is 5 minutes from me, and get all my medications, saving me a lot of time and a lot of trips to the surgery.
That's really good. That's really, really good. So who is the campaign targeting and why?
So we are targeting anybody over 16 is classed as an adult, can have the app. But again, we want to make sure that our BME communities are also having equal access to this app, because we do sometimes find that when we use digital aids, that some communities are left behind. And as I said earlier, it's a particular passion of mine to make sure that all our communities get equal access to healthcare and that nobody is left behind, that nobody feels that I'm not able to do this. They're not able to do it and they're feeling it's too hard. Then it's something we're doing wrong on the NHS. It's not the fault of the people. So we want to be here to say, come forward. No question is too silly. We can help you learn how to use the app, and then you can really take more charge of your health.
Yeah, I think with different generations living together at this minute, where very young people are so used to these kind of apps and other things, so whereas the older generation are not, even people in our generation, not everybody is so used to regularly using apps. Yes. Yeah, and it would be wonderful to know exactly what are the different features that we can avail from the app. What are the different facilities that we can avail? So, coming to my next question, I'll go into the facilities later on. What can be accessed? What does the campaign focus on?
So the campaign is really focusing on how we can enable more people to sort of to use the app, and what might be the problems that people are facing. So as I say, we know that there are a lot of long-term conditions such as diabetes, for example, that happens disproportionately affect people from South Asian backgrounds. We know that strokes, for example, disproportionately affect people who are from Black African backgrounds. So we want to make sure that people can use the app so they don't have any delays in ordering their medications. So we all know that we try to ring our practice at 8 a.m. in the morning and the tone is always engaged, and sometimes we just give up. So one of the great things about this app, like I noticed as a patient myself, was just how quick it is to be able to order things like your medication, to know your test results. And we just want to help people get over the fear. Something you just said, Anna, about sort of intergenerationals. One of the things I found is that before some of my patients were using their app, they obviously couldn't. Why would they remember the complicated names of all their medications? Whereas on the app, it's already written for you. So you just literally click, and you get your medication again. You don't need to remember necessarily how to spell all your medications. So that's just an example of how much easier things can be, particularly for those where English isn't a first language. You can take your time and have a look at it that's written for you.
And so, what are the other applications of this app? What other services can we get? For example, do we get to see? We go on to Google to find out about different symptoms and other things. One, you have talked about medication. It will make life so much more easier for people who are on regular medications. If you have done some tests, then you can access your test reports, I believe, through this app. Yes, you can. What are the other facilities that can be accessed through this?
So great question. So as you said, you can order medication, look at your medication, look at any medication you've been given in the past. You can look at your blood test results, and also don't worry. Obviously, we're not expecting everyone to interpret them. There will be a message to say it's normal. So you can, but you can actually look at the figures. You can
Mm.
also look at all your consultations. So if you can't quite remember what happened when you saw the GP, 4 months ago, that's all in your records.
Oh,
Um, but
fantastic.
you can also check symptoms. So you can actually access the NHS 111 online service via the app. Like I said, you don't need to go to Google. I think you can do that. And very importantly, you can get a directory of your local services. So if you think you want to use the pharmacy first scheme and go to the pharmacist, you can see where your nearest pharmacist is, where your nearest urgent care centre is. So it's quite a wealth of information that you have to help you rather than be Googling and phoning people. Because when we're not feeling well, we often feel like, what do we do? Where do we
Mm,
turn?
mm,
And
mm.
it's have a lot of information at at your fingertips on the app.
Perfect, perfect. So for appointments, we can go into the app and get our appointments done. Can we do the same for blood tests or vaccinations? Do we use the app
So
or?
you can see all your vaccination history and your blood test results all there. Obviously, if you wanted something requested and you wanted to speak to a healthcare professional, you can either do that via the 111, or certainly like the practice. This is dependent on your practice, but the practice I'm registered at, I can certainly go in online to do an online query with my own practice through the app. Definitely.
Mm-hmm. All right, all right. So there's this winter vaccination was going on. Do you think we could access appointments through or book for vaccination through it?
So that's a really good point, Anu. You can't book all your winter vaccinations through. That's one of the things at this moment, sadly, you can't do for all of them because different providers are providing that. It may not just be in your GP practice,
Yeah.
but again, it will certainly give you information on what centres are providing your winter vaccinations.
Okay,
Definitely.
wow, that's good. That's better. Like if it is not in your GP, where else can you find it? You can get information about that. That's fantastic. Yes. So it's the people in control. The app makes people in control of their health and their decisions. I think this is a wonderful step taken by NHS, although it had been taken 5 years back. But this is a wonderful thing. So, within my last few questions, I would want you to give us a pointer on why should people be using the app.
Well, I think having seen it as the doctor, but also very recently the patient, for me, it's far more time effective. There is no need to be queuing on that phone and hoping that the receptionist will answer your phone call and wasting your time. You can look at your health records. It also certainly my first experience of needing healthcare. I did feel very vulnerable. This only happened a few weeks ago, and being able to take a bit of charge, knowing that these were the diagnosis I was given,
Hmm.
made me feel a lot better and made me feel I was able to. And this is, being a doctor, and I felt very vulnerable, but actually having written information, knowing when your next appointment is, all of this is really helpful, and you're not having to call your practice to find out and wasting so much time, which sadly so much of our community has to, by
Hmm. Hmm.
getting
Hmm.
information.
Perfect, perfect, perfect. So, the reasons for using the app would be that you are completely in charge of your health. People are in charge of their health. They know exactly when the appointment has been made or when my prior appointments were, who did I see, what was my condition, what is my, if there are any reports, people know it. So they are completely in control of it. It will make your life so much more easier. And then the app will make things so much more clear. Like Dr. Farzana is telling us, explaining to us, it is going to make your condition very clear to yourselves, and you don't have to waste your time on phone just waiting on the phone to get through to the receptionist. Um, and uh, uh, about now it's an age where we talk about data protection. How protected are these apps?
So the app is completely confidential and it does require obviously your own secure password to go in. So that's each time. So even if somebody has my phone, my app is on my phone, there is no way they can get into my app because it's my personal password that only I know. So it's very secure. So nobody else can get access to your health information at all.
As long as you're not sharing it yourself.
As long as you're not sharing it. And of course,
It's
if you
pretty
wish to
manageable.
share it, that's fine. So I found it very helpful to show the hospital some of my things. So again, like you say, it helps us be in charge of our health and we don't need to remember all the conditions we've got and all the
Exactly.
medications we're on. It's written for you. So you can share that with any health professional or anybody you wish to.
Wow, that's good. Because I remember the last time I was in with my GP, I wanted to remember when was the last day when I had come to see the GP and there was a condition I was trying to elaborate, and it makes things a little complicated in my head at least. But although the GP was applauding, he said that, wow, you remember so much of medical things. But it was very difficult for me, and I think if I was using this app, it would have made things so much more clear for me and for my doctor. So that's really, really interesting. But if people want to know more about this app, about its applications, what's there, how to use it, where can we look for?
So there's a really good website. It's www.nhs.uk/NHS app. So it's www.nhs forward slash NHS app. Sorry, let me say that again. www.nhs.uk forward slash NHS app. And of course, if you do want to speak to receptionists at your GP practice, we will be more than happy to help because you're actually saving your practice time as well. So people will be happy to help you. And I found that the people that have had a little bit of time to just look at it and feel confident in it, they've only needed 10-15 minutes of training and then they've used it forever. It's just that initial fear that many people
Hmm.
have because
Hmm.
it's so please don't hesitate and feel that you can't do it or it's a new thing and new things are always a bit harder, but
Hmm.
lots of people are here to support you to use it. And once you've got it, I think I certainly will never stop using my app. It's been so helpful for me as a patient.
Another important thing would be that we always become a little lazy when we are to book an appointment just because we knew you'll have to wait on the phone call for really that long time. So now that you have the app and you can see where there's a I think we can see as patients where there is a vacancy and we can book it ourselves. So the date and time is provided to us. So that is going to be another point, where patients would be more eager to reach out whenever they have any problem, and they will not delay it. For patients who are actually suffering or have some critical illness and need to reach out to the doctors, I think this will motivate them as well in a very different way. I'm taking it from a very different perspective, but that you are in control of your health and your GP service, this will make things much more easier, and people probably will want to reach out to their GP without any hesitation, meaning that, oh my god, if I call, I'll have to wait for ages. That fear is gone now. If you are using the app, you can be in control. You can see when there's a vacancy and you can book yourself in right then. If you're unable to use, if you're finding it difficult, just reach out to the reception of your GP and they'll be able to help you. But that is one time help that you will be needing, probably even if you needed it twice or thrice, but you wouldn't be needing it anymore because we at the present time are all used to smartphones, all used to apps. It's just so easy. And I just hope this NHS app is really, really easy. I have had the experience myself, but I really did not know it has so many applications. So I'm going to look into it as well. Thank you, Dr. Farzana, so very much for all the detailed information. This was a very helpful piece of interview. I hope all our listeners and all our audience will um, take the message and use the app to be in control of your health and your records and will not delay in reaching out to your healthcare providers, to your GP or nurse, or get your tests done or get your medication booked in. If you are taking medication regularly, then it will make your life so much easier. So wonderful. Once again, Dr. Farzana, congratulations for the app. I know it's been launched 5 years now. Yet, if it is coming to practice now, if people are getting more awareness, it is worth that. I congratulate you for this. And thank you so very much for all the kind